Good evening, everyone. We'll start the class. It is already past 7, and I have waited enough time. I think we can start, and others can keep joining. So, today we are going to discuss the questions of week 7. Okay, so we'll start without wasting any more time. And today we have a lot of questions actually, so we'll try to be a little bit faster. And today I have not kept any explanations for any questions because I think the questions are very simple, as well as it's not required. If still you have any doubt, or if you, and I think the explanations are properly covered in the lectures given by Rupal ma'am. So we'll just go on through the questions so that you can practice all the 40 questions we have today. Okay, and we'll be a little bit faster. I hope you all can cope up with it. And obviously, I'll wait till you all answer in the chat box. Okay, so yeah, and yes, if any one of you has any doubt regarding any question, they can write it down in the chat box. So the rule is same. First of all, everyone should be muted for the audio and video throughout the session. And the second thing is, I will show you the question, and I'll give you around 1 minute time. You can answer your choice in the chat box, and then I will show you what is the correct answer to it. Okay, if you have any doubt, or if you are unable to understand any question, or if you want an explanation, please write down in the chat box. We'll discuss about it. Okay, I hope my audio is clear and the slides are visible. So we'll start with the first question. Okay, so the first question is, new mother is having trouble with attaching the baby deeply to her breast and getting more milk by day 3 of birth. What could be a possible reason among the following? Breastfeeding was not started within an hour of birth. Mother has big breasts. Mother is not talking to the baby. Baby is not hungry. Start answering. Okay, is everyone done? Let's see what is the answer to the first question. Correct answer is A. So if the breastfeeding is not started within an hour of birth, then the the new mother may face problem in attaching the baby deeply to the breast and getting the milk, and it may start the delay because the breastfeeding was not started within an hour of the birth. Okay, we move on to the next question. Fat rich milk is present in which part of the breast? Front, back, left, or right? Okay, is everyone done? Let's see what is the correct answer to this question. B. Back. So, fat rich milk is present in the back part of the breast. Moving on to the next question. What helps the baby to open the mouth widely? Mimicking actions like eating and laughing, tickling the baby's feet, rubbing the nipple on the upper lip of the baby, tickling the baby's back. Start answering. Okay. Is everyone done? Let's see what is the answer to this question. Correct answer is C. Rubbing the nipple on the upper lip of the baby can help open the baby's mouth widely. Okay. Moving on to the fourth question. To relieve symptoms such as engorgement or leaking of breast milk at work, the mother should express 200 ml of breast milk, 100 ml of breast milk, 1 drop of breast milk, only as much as is necessary. Okay, let's see what is the correct answer to this question. Correct answer is B. So, if there is a problem in leaking of breast milk at work, to prevent those kind of conditions, the mother should express or store the breast milk only as much as is necessary. Okay. Moving on to the next one. Breast milk can be stored for up to dash in a fridge under clean conditions. 7 days, 5 days, 15 days, or 2 days. Okay, I guess everyone is done. Let's see what is the correct answer. The correct answer is 7 days. So the breast milk can be stored up to 7 days in a fridge under clean conditions. Okay. Moving on to the next one. When should skin to skin contact be started if the mother is COVID-19 infected? after the mother tests negative for COVID-19, immediately after the birth, when the mother doesn't show symptoms 3 days after birth. Okay, I guess everyone is done. Let's see what is the correct answer. The correct answer is B. Even though the mother is COVID-19 infected, the skin to skin contact should be done immediately after the birth of the child. Right? Okay. Which of the following is a baby's fullness sign? Crying, closing mouth, sucking fingers, turning head from side to side. Start answering. Okay. Let's see what is the correct answer. The correct answer is B. Closing mouth. So closing mouth is a sign that baby is full and you can stop feeding it. Right? Moving on to the next one. How many times should the baby be breastfed at night? Once, twice, 3 to 4 times. Baby should not be breastfed at night. Okay. I guess everyone is done. Let's see. 3 to 4 times. So the baby can be breastfed at night around 3 to 4 times. Moving on to the next one. Dash from squeezing of the nipple and areola by nipple shields is common. Nipple growth, nipple injury, flattening of nipple or areola growth. Let's see what is the correct answer. The correct answer is B. So nipple injury is common when you are using nipple shields because of the squeezing of the nipple and the areola. Moving on to the next. In side-lying hold of breastfeeding, the mother should hold her breast in which shape? From the side in a C shape, from underneath in a U-shaped hold, from underneath is in a scissors shaped hold, from the top in a U-shaped hold. So the correct answer is A. From the side in a C-shaped hold. Moving on to the next question. Should the mother wash her breasts before breastfeeding? Yes, every time. Never. Only if she has been coughing on her chest. Yes, twice a day. Start answering. I hope everyone is noting down their uh, number of correct answers and wrong answers. We'll check at the end of the session. Okay. Okay. Let's see what is the correct answer. The correct answer is C. Only if she has been coughing on her chest. Moving to the next one. In cradle hold for breastfeeding, the mother should hold her breast in which shape? From the side in a C-shaped hold, from underneath in a U-shaped hold, from underneath in a scissor-shaped hold, or from the top in a U-shaped hold. Okay, let's see what is the correct answer. The correct answer is D. From the top in a U-shaped hold. Moving to the next one. Which hormone is produced at higher level during the night in a lactating mother? Oxytocin, prolactin, progesterone, aldosterone. Start answering. Okay, at last we'll discuss that question. Okay, let's see what is the conclusion. See that the last. Okay, so the correct answer is B, prolactin. So this is the hormone which is at a higher level during the night in a lactating mother. Moving on to the next one. When using frozen breast milk, ideally defrost it by keeping it for dash on the lowest shelf of the fridge. 6 hours, overnight, 10 hours or 2 hours. Let's see what is the correct answer to this question. The correct answer is B, overnight. When using frozen breast milk, ideally first defrost it by keeping it overnight on the lowest shelf of the fridge, right? Moving on to the next. For how long should the mother wash her hands before and after touching the baby? 1 minute, 30 seconds, 20 seconds, or 10 seconds? Let's see what is the correct answer. The correct answer is C, 20 seconds. So the mother should wash her hands at least 20 seconds before touching the baby. Moving to the next one. Which body parts help breast milk flow freely after massage? Neck and shoulders, neck and lower back, neck and upper back, or neck and stomach? Okay, let's see. The correct answer is neck and upper back. So if you massage on the neck and the upper back of the mother who is breastfeeding, it helps her breast milk to flow freely, right? Moving on to the next one. Germs do not start growing in fresh breast milk for at least dash even in a hot climate and outside the fridge. 1 hour, 3 hours, 6 hours, 12 hours. Okay, let's see what is the correct answer. The correct answer is C, 6 hours. Till 6 hours, if you keep the fresh breast milk even in a hot climate and outside the fridge, germs won't grow on it, but after that it can grow. So it is recommended to store it in the fridge. Sore or cracked nipples is a condition where nipples become wet and shiny, itchy and dry, soft, hard. Okay, let's see what is the correct answer. The correct answer is B, itchy and dry. So whenever there is a condition of sore and cracked nipples, the nipples become itchy and dry. Moving on to the next one. Nipple shields dash the baby's time spent resting during breastfeeding. Increase or decrease? Let's see what is the correct answer. The correct answer is A, increase. Nipple shields increase the baby's time spent resting during breastfeeding. Moving on to the next. Why is massaging of the breast before breastfeeding important? It helps to open the milk ducts. It ensures the baby to attach deeply. It makes the mother's areola softer. It helps mothers with flat nipples. Let's see, correct answer is it helps to open the milk ducts. So massaging of the breast before breastfeeding is important so that it can open the milk ducts and the breastfeeding flow can be correct. Right? Moving on to the next. What is hand expression of breast milk? Manual removal of breast milk using hands, massaging of breasts using hands, warm compression of breast using hands, extracting breast milk with a hand pump. Let's see what is the correct answer. Correct answer is A. Manual removal of breast milk using hands. It is called the hand expression of breast milk. Moving on to the next. Build up mother's milk supply, and if it seems to be decreasing after a few weeks, she should express breast milk every dash hours immediately after breastfeeding the baby. Okay, let's see what is the correct answer. The correct answer is A. 1 to 2 hours immediately after breastfeeding the baby. Breastfeeding the baby. So, to build up mother's milk supply, and if it is decreasing, then the mother should express the breast milk every 2 hours after breastfeeding the baby. Okay. 23. In case of poor latching, feeding expressed breast milk with a dash is good for the few first days of the birth because during these days only a small amount of milk is needed. The correct answer is spoon. So in case of poor latching, that the baby is not attached to the nipple properly, the breast milk expressed can also be given to the baby for the first few days with a spoon, because a small amount of milk is needed for the first few days, right? Moving on to the next, dash hormone which helps the breast milk to come out: prolactin, oxytocin, aldosterone, or growth hormone. Okay, let's see what is the correct answer. The correct answer is B. Oxytocin hormones helps the breast milk to come out. Moving on to the next, if a COVID-19 infected mother is too unwell to breastfeed, what should be done? Immediately start giving formula to the baby. Immediately start animal milk. Try feeding expressed breast milk of the mother to the baby. Start giving complementary food. କ୍ଲାସ୍ରେ ଅଛି କ୍ଲାସ୍ରେ ଅଛି କାହିଁ କଲ୍ କରୁଛୁ ମୁଁ କାଟିଲି Okay, let's sorry. Let's see what is the correct answer. The correct answer is C. Try feeding expressed breast milk of the mother to the baby. Moving on to the next, what should the mother do when the baby falls asleep while breastfeeding? Let the baby sleep. Wake the baby up by gently tickling its feet or back. Force feed formula when the baby wakes up. Wake the baby up by sprinkling water on it. Okay, let's see what is the correct answer. The correct answer is B. Wake the baby up by gently tickling its feet or the back if the baby falls asleep while breastfeeding. Okay. Moving on to the next. During breastfeeding, mother expresses milk and thin milk comes out. What should the mother do? stop breastfeeding, continue feeding from the same breast, offer the other breast to the baby, express the thin milk completely from the breastfeeding again. Already we have discussed this question in the last week, I think. Okay, let's see what is the correct answer. The correct answer is B. Continue feeding from the same breast. Right? Moving to the next. If the mother is tired and has back pain, which breastfeeding hold is recommended? Cradle hold, cross cradle hold, football hold, or laid back hold? Okay, let's see what is the correct answer. The correct answer is laid back hold. So, by laying back, the breastfeeding can be done if the mother is tired and has back pain. Moving on to the next. Is it safe for the mother to continue breastfeeding when she is pregnant? Yes, no, depends on the weight of the first baby, depends on the mother's diet. It depends. Yes, it is safe for the mother to continue breastfeeding even when she is pregnant. There is no problem at all. Moving on to the next, the baby might swallow too much dash because of the nipple shield. Hind milk, fore milk, air, water. It's C. The baby might swallow too much air if uh, they are sucking through the nipple sheath, right? Moving on to the next. When the baby is deeply attached to the breast, which part of the breast should be in the baby's mouth? Only the nipple and the lower areola, whole breast, nipple and the upper areola. This question also we have already discussed in the last week. nipple and the lower areola. This is the proper type of attachment that should be done between the baby and the breast of the mother, that it should, the baby's mouth should be touching the nipple and the lower areola, right? 32. The mother should express milk at least every dash hours, including during the night. 3 to 4 hours, 2 to 3, 1 to 2, or 4 to 5. The correct answer is B. So every 2 to 3 hours, the mother should express the milk, even including during the night. Moving on to the next. What can the mother put in the baby's nostrils to clear dry mucus before breastfeeding? Coconut oil, castor oil, water, nasal saline drops. The correct answer is D. Nasal saline drops. So the baby's nostrils can be cleared by adding nasal saline drops to the baby's nostrils. Moving on to the next question. Breast milk which is frozen solid in a separate freezer will be good for dash 3 to 6 months, 2 to 4 months, 1 to 2 months, 1 month. Let's see what is the correct answer. The correct answer is A. 3 to 6 months. The breast milk which is frozen solid in a separate freezer will be good for 3 to 6 months. Moving on to the next. Mother should store the breast milk containers in the dash of the fridge. This is the coldest area of a fridge. Back of the lowest shelf, topmost shelf, door, middle shelf. Okay. Let's see what is the correct answer. The correct answer is A. Back. Yes, the correct answer is A. Back of the lowest shelf. The mother should store the breast milk containers in the back of the lowest shelf because it is the coldest area of the fridge. Moving on to the next, which hormone level does not rise because of a remaining piece of the placenta in the mother? Oxytocin, prolactin, progesterone, aldosterone. See what is the correct answer. The correct answer is B. Prolactin. The hormone level does not rise because of a remaining piece of the placenta in the mother. Moving on to the next question. Which baby should not be breastfed during the COVID-19 pandemic? Babies born to mothers with suspected or confirmed COVID-19, babies with suspected or confirmed COVID-19, babies with symptoms of COVID-19, or all babies should be breastfed according to the standard infant feeding guidelines. Okay, I guess everyone is done. Let's see. Correct answer is all babies should be breastfed according to the standard infant feeding guidelines. Irrespective of the mother is infected with COVID-19 or not, the baby should not be prevented from getting breastfeed from the first hour of the birth. Moving on to the next, what other foods and fluids can be given to the baby under 6 months of age? Fruit juice, rice water, formula, nothing except breast milk. Already we have discussed about this topic in the previous weeks. Okay, this was a very easy question. Let's see. Correct answer is D. Nothing except breast milk. As for the 6 months of age of the baby, the exclusive breastfeeding should be practiced. That's why any other food or fluids should not be given. Right? Moving on to the next. Mother complains about reduced breast milk supply. What could be a possible reason among the following? Poor latching or nipple feeding, deep latching, small breast size, or not using a nipple shield. The correct answer is A. Poor latching or nipple feeding. So the reduced breast milk supply could be due to poor latching or because of the nipple feeding of the baby. Right? Last question finally. When a mother may ask about using a nipple shield, it is important to first ask her about her breastfeeding technique and problems, her breast and nipple size, her budget for the nipple shields, or size of her areola. The correct answer is her breastfeeding technique and problem. So, when a mother is wanting to opt for a nipple sheet, it is very important to discuss why she wants to opt for that, what is her problem, and what is her breastfeeding technique, and why it is insufficient for the baby through direct breastfeeding, and why the nipple shield is required. Okay, so with this, we are at the end of the session. Let's see what are your marks out of 40. 37, very good. 38, good. 35, 38, nice. Okay, I guess everyone has performed good. So we'll end the class and meet again next Tuesday. Thank you, everyone. Questions? Okay, we'll disperse. I'll end the class.